So I've got S2 here, and what do we say, C7?
Yeah.
About up here. So I measure 22 inches right now, okay? I'm going to have you, go ahead and, Sean, go ahead and try to touch your fingers to the floor. Okay? And now we go to 25. So we started at 22, and now he's at 25. Now come on back up. That's a 3-inch difference. 4 inches is what's considered normal. For extension, you do the same thing, but we don't have any norms established for that. So here, again, C7, S2. Let me start this way. What I'm going to do is I ask my patient to bend. Sorry, hold on 1 second here. He would bend backwards, okay? And now I subtract. I say, okay, now he went from 22 to 18, okay? So, or whatever it was, I don't remember what, I'm just saying. So whatever that distance is what you're going to measure. So that's one way to objectively quantify how much extension range of motion somebody has. Perfect. So we're here, so T1 here, and right over the sacrum here. You're going to zero them both out, and you could be right over kind of S2 here as well. You would zero them both out. I'm not going to do that just for sake of time, but zero them out. Go ahead and bend forward. Okay? And then again, I subtract the numbers with that. And I could do the exact same thing for lumbar extension also. Some people will do just lumbar, where they'll go from T12 to the sacrum. So go ahead and bend forward. So I just want you guys to make that distinction. When you're doing T2 or T1 to the sacrum, it's thoracolumbar flexion versus this, which is just lumbar flexion. Okay. And essentially what we're doing here is our fulcrum is over, what's it say, S1 or S2 on that one? S2. Okay. And my moving arm is lined up with C7. So I'm just basically bisecting the spine, and I ask him to bend sideways. And then I find C7 again, and I take that measurement. All right? So it's the same as you would do for cervical, but you're just changing your landmarks. So I'm basically here. So again, iliac crest or L4, come down to the PSISs, right across that is where S2 is. All right? So S2 and T1, zero these guys out, and now go ahead and bend sideways to your right. And then you just subtract your two measurements like that. Okay, so that's not a difficult one to do either. All right, and then come on back up. Patient is in prone, hands behind your head. Okay, you're laying flat, hands are behind your head. Okay. Under normal conditions, the therapist might hold your ankles down. Okay. What I'm going to have you guys do is just try to raise your head, your chest, and your shoulders off the table. Just hold it. Can you do it? 4 is, it says it yields slightly due to lack of reaching end range. So you can kind of get there, but then you kind of like back off from end range. 3 would be able to, is where you can extend, okay, against gravity with your arms by your side. If you have a muscular problem at all, it's usually lumbar endurance versus lumbar strength. So we should be testing the endurance component versus just like a manual muscle test like Kendall does, okay? So that's the trunk muscle endurance. This is just looking at the trunk flexors. Hands are behind your head, legs are straight. All we're asking you guys to do is basically a partial sit-up here where you are trying to lift your shoulder blades off of the table, okay? So can you sit up that far that your shoulder blades are coming off the table? If you can't do that, you guys look pretty good. Can you clear the shoulder blades? Yeah. So arms are outstretched, and now roll up that way. And that should be even what we call a trunk flexor muscle endurance test. So we're going to have the hips and knees flexed to 90 like this. Okay, so legs up in the air. Arms across the chest. And all you're doing here is you do a partial sit-up and you hold. And you just see how long you can hold it there. Now, I don't believe there are norms for this. So I'll just say for you guys, just hold for like 5 minutes or so. It's very important. So watch how I do this first of all. So first of all, what I do is I say, okay, bend your knees at 40. Yep. Okay. I want you to flatten your lower back. So you have to teach them a pelvic tilt first. So just keep your back pushed in against my hand. And I feel the pressure under my hand. Now what I want you to do is bring one leg up straight. Good. Now keep that back against my hand. Bring your other leg up straight. Keep that pressure. Now, hold that pressure against my hand and start to lower your legs, both of them together. Start to bring them down. As soon as I feel her, she lost it right there, 45 degrees. As soon as you feel that pressure come off of your hand is where you take note of how far down she can go.
No. You can use a blood pressure cuff too.
A blood pressure cuff is perfect for that. Yep.
What can they do with their hands?